Okay. Shall we start the meeting? Are we ready?
Okay.
Okay, Pledge of Allegiance. I pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Stacy, would you take the roll call, please?
I will go in alphabetical order. Mr. Jack W. Balch.
Here.
Mr. Kevin Home is excused. Mr. Al Lazo.
Here.
Mr. Jack Rogers.
Here.
Mr. Craig Steckler.
Present.
There are no oral or written communications at this time.
Okay, can I have a motion to approve the minutes, or does anybody have any questions?
I move to approve.
Second.
All those in favor?
Aye.
Aye.
Abstain. Okay. Bob, can we get an update from you, please?
Our schedule, as you can see, is up on the screen. And basically the first top half of the activities are either completed or very close to completion. And the bottom half, which is very important, is the areas that we're starting to get engaged into, which is the serious final commissioning of all the equipment, both medical and mechanical. Final inspections will be followed by the FLSO, the Fire Life Safety Officer for Oshpot. Just prior to that, all the individual IOR inspectors, special testing labs, and all those group of people have to do all their final sign-offs before the FLSO will even come in. So all those are commencing as well. Oshpod's final inspections and sign-offs, as you can see, is scheduled to go through February, March, and April at this point. Early staff and stock right now is scheduled for early April, and unless we have some setbacks or impacts, that should not slip very much at all. Depending on how successful we are with all the individual inspections is the only thing that might push that out. Right now, we are also still have our grace periods for both the owner and the contractor. Our weather contingency, the major portion of that, which is 21 days, is still in place. And if we have any winter like last year, we'll probably use all of those days. Because it won't affect the work in the building, obviously, but we have all the civil and site work yet to go. And so it will have, we are weather dependent on that exterior work. Contract substantial completion is, as we discussed on the tour, is early June, with final completion for the tower for occupancy is August 10th. Site work, loading dock work, plaza work, and all those will have somewhat of a completion after the building is occupied and used for its intended use.
Any questions?
Can we go to the cash flow?
We have two cash slides. That one is the cumulative construction cash flow. The green line was the original budget cumulative curve. The red line is the actual gross invoices to date. And as you can see, those lines have joined together in the month of August.
The fact that you say it's cumulative, does that mean that you're just slightly above budget because of the invoiced versus budget, the red line coming?
But the green one was the forecast of what
Right.
the invoices would be.
But because it's run fairly parallel all the way along, except for it looks like the mid slide there.
Yeah, that was they had the equipment arrive a few months early, and we had that forecast out later on. So there was,
So you think it'll offset eventually, and you'll be right on, just about on budget?
that's exactly right, Jack.
Okay.
Sure.
Give you an idea of what's happening.
And of course, this is the same data information, with the green being the forecasted budget, and the red is the individual monthly invoices from the general contractor. And there's those red spikes again, Jack,
Exactly.
and then it starts to tail down to where we are in August, where even the months have matched up, and it appears that the rest of the year will follow suit.
Anything else? Any questions? Mr. Fain?
So I will give Ray Graves' report. And as he has consistently reported, our percent time elapsed is a little bit less, or lagging the percent earned, for the reasons that you've just gone over in terms of the requests for payment increasing when they took a large amount of equipment. So from that point of view, it's an indication, it could be an indication in some cases of us being in trouble in terms of you're ahead in the payments and your work is lagging, but in this case, our work is pretty much going on time, and it looks at this point like they could be done a little bit ahead of schedule. So for that reason, we think that the being a little bit ahead in our payments is a good thing, and that progress is going as planned, and I think everybody's happy with where we are. As you saw in the last report, the monthly earnings are trending down, so that, you know, we anticipate this to get closer and closer as we get closer to the completion of the project. The schedule right now, as stated in the walkthrough, we expect most physical construction to be done early. The official date for them to be early is like April 1, something like that. It may be earlier than that. It's all good. You know, our substantial completion is June, so anything ahead of that is basically all positive for us. As I think we've reported multiple months or multiple quarters, our biggest issue for probably a year now has been the fact that we redesigned the accesses to the building, both the driveways for the emergency room, both the patient and ambulance entries, the connection on the first floor, which is now an open-air canopy, which was changed, and the connection on the basement floor, which is a corridor in the back of a new loading dock, or a continuation of an existing loading dock. All these things, before we even started the project, we were unhappy with the connections that were there from the original design. So we had them redesigned. They went to OSHPD. They were, gone through approvals. I think the only thing that we're still waiting on a final approval is the canopy. Still something we're waiting for a final approval on.
Yes, you're correct on the canopy, both the exterior work, we've received that back from OSHPD. The loading block, you're correct, we've received back from OSHPD. The canopy, we've gotten one response, and now the written responses have gone back to OSHPD, so we're into the second round of review with the responses. And then the only other one is doesn't go through OSHPD, and that has to do with the underground storm sewer and sanitary sewer work.
Right. So the work is we've already had some work done on the basement level canopy, and that is going to start. We had a lot of underground work done, but it's going to start in full force in about a week. So that whole back entry, which has been an employee entry, will be under construction, and we'll have new entries for the employees off the garage and things like that. So that's one of the things that will go up to substantial completion. The canopy we anticipate having from Oshpot any moment, then that will start. I think we, excuse me, we may have reported, I can't remember last time, that we have, while this project was going on, we found we had a sort of a catastrophic failure of our plumbing in our kitchen. So that is also that's not related to this job, but our whole kitchen is under construction, and we put in a mobile kitchen.
Your existing kitchen?
Our existing kitchen in the old hospital. And we put in a mobile kitchen in the area that the canopy is going in. So the kitchen is there now.
So you have to time it.
We have to time it. So, if everything goes to plan, we should have the kitchen ready or done around Christmas time. We get the mobile out of there, and then they go into the connecting canopy. So obviously, that's pushing up to our final completion dates. And those are the things that we're more, in terms of hitting our dates, those are the things we're concerned about. The building itself looks like we're going to be fine.
I just have a very important question about
Yeah.
the kitchen.
Yeah.
Is that going to improve hospital food?
Well, we happen to think our food is pretty good. We get a lot of compliments on our food.
I'll take your word for it. But going back to the percent earned versus time lapse,
Yes.
it's close to 10%, 8% or so. When one of us, I take it, Ms. Jack goes to the board and makes this presentation for the annual,
Yes.
that will still be an issue, right? Be reflected still there.
Yes, because he'll go for June of this year,
Which
that
was
As of this-
even more skewed.
a little bit of a difference, yeah.
So I think it's important, just that's an obvious question.
Yes.
Someone could ask curiosity. What is, the main reason, other than we receive equipment earlier or we order earlier, to identify kind of a subgroup of, I always thought that the steel, for example, was ordered a lot earlier because we were competing with other projects.
Well,
And at
that's
that time, the Apple campus
That's correct.
was about, I think Stanford is also. So I think it's good to just be prepared for that.
Okay.
Because that's an obvious question that
Sure.
would logically come up.
Yes.
Better be prepared to identify the more specifics other than
Of what a general
as opposed
statement.
to just we received some equipment earlier than we wanted to.
Yeah. Okay. Yeah. You are correct. We did a lot of purchasing up front, for instance, the dampers that were in the sub-basement and the base isolators. Yeah, we bought all those
Ahead of time, because we
before
were competing
put a
with
shovel in the ground.
other projects. So
Yes, that is correct.
That is exactly right.
Yeah, and I think that's important because we tend to forget, circumstances.
Right.
Under which, so it's just important to. I always like to even cut off those questions, but just answer before they're asked.
Correct.
Yeah.
Well, we like to do this. We intentionally look at these numbers because we found that it's kind of a leading indicator in terms of if you're going to go into trouble. In other words, if your contractor is getting a lot of money up front and getting money ahead of your progress, it's
That's an
sign of
obvious
a
red
problem.
flag.
Yeah, and in fact, in this case, you can see with the progress, we're progressing really, really well. So it's not a matter of.
Yeah, I think it was forced to be that way on purpose. It was purposely done
Correct.
for a number of circumstances, and I think we
We're
just
back
need to
in
explain
sync,
that.
so I don't think it'll be an issue.
No.
We're back in sync. If we were out of
Yeah.
sync at the time,
Yeah.
might be an issue, but we're perfectly in sync.
But this
so-
is as of June, right?
Yeah.
Yeah,
Yeah.
but I think Jack's right. You just explained that
Yeah.
we're back in sync.
Yeah.
You had this early delivery, now it's accounted for in the budget and caught up. So, And I'm wondering, on large projects like this, when you're at the end of the project, is when you can end up with dispute over change orders.
Yes.
And, and that's when things can really start to go sideways on you if you're not monitoring.
Correct.
So I'm wondering, do you have an in-place process in which you're resolving disputed change and dealing with that on an ongoing basis rather than waiting till the end?
There was
Yeah.
a faint of smile there.
I think that's on your next slide, is it not?
Yes, but let me just generally state, that is something that has been a focus of ours for, I will tell you, when we started the project for the first almost 18 months of the project, we didn't get a change order. And so we were feeling great about that, and then we started to get them. And it's been actually an effort for, I would say, the last almost year to get those resolved as they come. So we didn't get any, then we started to get them, and then we kind of got a lot of them, so we were a little behind. And we have got extra resources in to finish negotiations on those. And so I wouldn't say that we are entirely caught up, but we have resolved the vast majority of them. The ones that are outstanding, we have none at this point that we know of that are in dispute, that we think
No
that they're...
ticking time bomb
We
out
have
there.
no ticking time bomb out there. We have still change orders that are not resolved, but it's much less than what we've had. You can see here as an indication, this requested change orders were at 8.9 million, and we have 2.8 million pending. So we've resolved 6 million of them. And of all of that 2.8 million, we're not concerned or feel that there's something out there that's going to be a big problem. Bob, I don't know if you have any other insight.
I concur with all that analogy, yeah. It's been a constant effort, but it's been a positive effort on all parties involved. It's not been confrontational it's been a positive effort by all parties to resolve these.
Yes.
And by the management of all the companies as well.
Yeah. So I would say, so there is some kudos to go to places like Jacobs, Ray Graves as well. Yeah, but I would also say that, we have been very happy working with Rudolph and Sletton. We found them to be reasonable. They're not perfect. There were some change orders, for instance, that we would have wished that they got pricing to us a little bit quicker, but it hasn't resulted in problems, and they have been very good about resolving issues. They're at the table with us, working with us. We're not getting into any kind of dispute, and we have a mechanism to elevate things within that company as we have problems, and we haven't had to do that at all. So
That's correct.
Ed,
yes,
when we talk about change orders, my understanding of change orders, generally, it's caused by the hospital. They've said we want to change this or that. There's also a thing called a request for clarification.
yes,
Are those requests for clarification included in the change order?
yes. This is everything.
Okay.
So there definitely were some things that the hospital asked for, particularly, I would say, focused mostly on, once we did the mock-ups, we walked through, I think there were 14 things that the hospital asked for changes. The mock-ups were mocked up as designed, but now once you're there and seeing what it's going to operate within, we made changes there, or we made requests there. There were a few other, I would say, relatively minor things. The vast majority of things have been a combination of, I would call, constructability issues that were found in the field once we got in, once construction's going up. And then frankly, there are some that I would also attribute to an error and omission things, where there's things, either lack of clarity in the plans or conflicts between structural and architectural drawings that we end up, the owner ends up paying for. And we track, we divide them up and we track what's happening with each one. And You know, as I learned early on, there is no such thing as a perfect set of plans. You always have errors, right? And when we were tracking it, I would say the error and omission part of it is probably around $1 million and a half, that neighborhood right now. I don't remember offhand what the owner requests are, but again, I believe it's less than $1 million. So it's the other issues that have been the lion's share. I think I've talked in the past of things like, once we got in there and found there were some major issues in the allowances that were put aside by the contractor for the fire alarm and the security system. I think those are the two biggest things that we've had to sign change orders for. And it was more, the scope of the work was not adequately estimated up front. It was more involved. It was a what they call a delayed review process by OSHPD. It was not approved in the original plans. The contractor put an allowance of what he thought it was going to cost when the final design is done. The final design gets done, and the bids that come in are way higher than what he had set aside. Those have been the biggest single change orders that we've had. So, I mean, on all levels, I think it's gone, pretty well. Yes, there are change orders. It's not perfect, but there's no one that's just out there glaring, and there's no single, which by the way, we have had in other projects. There's things that you can't resolve. The project's done, and then you're in negotiations 2 years later trying to sort it out. I can't guarantee that's not going to happen, but as we sit here today, I feel very comfortable saying to you that it looks like we're going to be okay, and we should get this thing resolved and finished off in time and not have any ongoing disputes.
Thank you.
So the only other things I wanted to say was the quality of the work. We've had minimal quality issues. They track all the we have hundreds of inspections every month on whether it's welding or steel or the drywall going in. Gets it. We have 3 inspectors on here full time, and the inspections are passing the first time around. On the first inspection, I would say 95% of the time, 98% of the time. So the quality-wise has been very good. We can't say anymore that there were no injuries on this job. There have been a few minor ones, but nothing substantial. And our experience in terms of the workers' comp, which I think we've explained, the hospital has an owner-controlled insurance product for that. It's been, at this point, I would say, what has been spent so far is under $200,000 for any kind of injury or claim on the job, and that includes back strains, knee strains, things like that. So it's been, again, very good experience, no major injuries, anything like that. Okay.
Do you not have another?
Yes, we do have more to cover, and that would be the financials.
Okay. Does that go to Dan there?
Yes, so Dan is taking Chris Henry's place today, and Dan has reported to us once before.
My pleasure to be here with you today. So we'll start with our project funding. Just a reminder, we started with a budget of about $346.5 million. As of last May, when we met, we had expenditures of about $241.2 million. Through this period, through August 31st, we've incurred $19.6 million in expenditures. Of course, the majority of that coming through construction, giving us total expenditures as of August 31st of $260.9 million, with about $85.6 million left in the budget at August 31st. And of that $260.8 million of expenditures, $255 million of that has been reimbursed with GO bonds. Okay, moving into our project cost to completion. Those total expenditures of $260.9 million, and we estimate to complete, as of August 31st, about another $82.3 million, giving it a total estimate estimated cost upon completion of $343.1 million, bringing us in about $3.3 million under budget at this point.
That does not take into account all the contingencies that are pending, does it?
It does, this is all the contingencies. So in this
$6
case, we have as a total project contingency the $6 million bucks.
$6 million.
And this is saying that we would be into that by 2.7 million is our projection for the end of the job.
Correct.
So we would finish the job and still be at 3.3 million. And this is our projection based on everything we know right now, all the change orders that we have. It's not, it's,
Okay, so
it's,
that does include approximately 10 million in change orders that are pending,
Yes.
approved, and previous?
yeah.
Okay, thank you.
And my sense is before we're over, I think we're going to be very close to being at the break-even part. The only other thing I mentioned last quarter is we have things before the board currently for asking for money for things that were not included in the projects. For instance, the connection, we talked about a minute ago, the canopy connection on the first floor. That was not in the plans. That was not in the plans and specs because we were unhappy with it and we deleted it from the job. So there was a recognition that at some time down the road, we would have to go and approve a budget for that. That's not in here. That will be a different board action. When they take action, we'll show it in here. And we can show it as a different line
It'll
item.
be outside of the funding here? or-
It will be outside of this funding, yeah.
So will bond funding be used?
I think at this point, we've got sort of all the bond funding committed, so it would come out of revenue bond funding from the hospital. And the hospital, I think as we talked about last time, the hospital has gone out and done some revenue bond financing, so we're sitting on money to cover this type of thing. That's in excess of the general obligation bonds. But that's one of them. There's a parking lot in the back where we currently have the old helipad and things like that. Those are all excluded from the job. And so the board, will make some decisions and then we'll have some additional money that we'll have spent on it. But it shouldn't, that is not included in these numbers. These projections are what we're talking about for the building and everything that's been bid and in the plans today. And this is where we are, what we know and what we project from what we have right now, from everything we've gotten from the contractor.
So those add-ons that you're talking about to the bond, that the board is looking at,
Yeah,
are not they're of interest to us, but they're not under the direct purview of this committee.
correct. But they would be of interest because in some of them,
They marry up. Yeah.
yes, and we'll have to get a final approval from OSHPD to occupy. We'll have to have
Right.
some of those things in
Exactly.
place.
Yeah.
Okay, so then if we move down to the funding sources and top complete. As you know, we started off with about $290.3 million in GO bond funding, including the interest earned through August 31st of about $976,000. Total Phase 2 expenditures, as we mentioned, we're at $260.9 million. $255 million of that being reimbursed through GO bond funds, bringing us to $35.2 million still available to us in GO bond funds. Estimated additional funding sources coming to about $16.3 million, including the 2017 revenue bonds that Ed had just mentioned, the Washington Hospital Healthcare Foundation pledge funds of about $4.2 million, and the Washington Hospital Specific Purpose Fund at about $2.7 million. Bringing us to our estimated cost to complete at $82.2 million. Add back the amounts not reimbursed by the GO bond funds of about $30.7 million, leaving us with a total net construction cost to complete of about $51.5 million.
Anybody have any questions?
I guess maybe because I'm new to the committee, I don't quite understand the add back, the amounts not reimbursed by GO bonds. Can you give me an example what that might look like, or?
Yes, I can.
Those could be equipment.
Yeah, so all the if you look at that amount ties to the line item of the equipment in the financials.
Yep.
And the equipment cannot be financed by GO bonds.
Yeah, I understand that.
Okay, so we take that back out. That's
That's why you contributed to the foundation.
Yeah.
that's right. So as you can see here, we've got the funds that we've got from the foundation and others is going towards this, and then you've got the 9.3 million of the available 38 million in revenue bonds that are making up any shortfall. Okay.
Okay. Ed, it's back to you again.
I think our next thing is the schedule, and the next meeting we have is Wednesday, January 17th. Same time, same station, 2018, correct. Okay. Oh, Stacy's pointing out that we're back to the 5 PM versus the 4:30 timeframe.
Okay.
Back to
It'll be dark at 5 PM.
Well, hopefully we'll be all lit up over there.
Well, they might change it back. You know, the time usually changes on us before the meeting.
That's good.
50% chance the date will change, 70% chance the time will change.
Yeah, you're so confident.
So we should write these in pencil, is what you're telling me.
If there's no other business, meeting adjourned. Oh, excuse me.
How much money from the hospital reserve fund in your general, I guess would you call it your general operating fund?
Yes,
You have a reserve amount that's in your reserves.
set aside for this?
Well, I'm wondering, is any of the hospital reserve funds coming to this project?
No, no. So we have cash on hand,
Right.
okay, that comes from operations, and that's being kept totally separate from this. So this is all paid for by the GO bonds, the revenue bonds, and then the contributions to the foundation.
Okay, and on the contributions, the foundation,
Yes,
you have the 4.2 in hand,
yes,
and you have 1.8 that's pledged.
yes.
That
And-
will come in before the project
Yes.
completes?
Yes, and that actually has grown fairly substantially in the last
Yeah, I was
6
there.
months.
Last Saturday.
Right,
Yeah.
exactly.
50 grand.
So, yes,
So you
so
want to match that?
we may be in a position to use less of our revenue bonds with the
Okay.
contributions that are coming in.
Thank you.
Yes,
Go ahead, no.
I made a couple of notes.
Yeah.
The connections you were talking about
Yes.
between buildings. At one time, I just don't know where the hospital is on this right now. At one time, you were abandoning the existing hospital and moving to this one. And then I've heard that there's talk about continuing to use some of the hospital. And I'm wondering, will there be enough flexibility that will allow you those options?
to move back and forth. So, the issue is that we have legislation from the California legislature that's called SB 1953 that says we have to make all the buildings meet a certain structural category of performance. And we went through this back in '96 to get our buildings evaluated. So all of our buildings are clear until 2030. So we don't have to do anything, and so this new building next to the existing building can function, and people can go back and forth without any issues.
And the connections look like they're usable, you feel good about those?
Yes, I would say to you, of everything about this project, I feel I feel that the most improvement for the future is going to be in the connections. It's not going to be easy or simple, because it's just the issues of coming back and forth between those two, trying to separate public, trying to separate the patients.
Operations, yeah.
And it's we could use about 4 connections, and we've got 2. So I think that'll be improved over time, because we already have plans to make some others down the road. But when we open up, I think that will be probably the level of greatest frustration.
The pinch level right
Yeah,
there.
yeah.
And then my last question has to do with your final inspections and all that stuff, I understand. But there's going to be a phasing of movement of patients.
Yes.
And I don't need to know the plan, I just need to know that you've considered it.
Well, yes, and we actually, it's funny you should bring that up, because we have gone through a RFP process for what's called transition companies that do this, and there's been a lot of this work in hospitals lately, because a lot of hospitals in California have gone through the retrofit. So just in the last 2 years, Highland, Kaiser Oakland, Kaiser San Francisco General, Mills Peninsula, they've all gone through these transitions of moving from one hospital to the other. UCSF, a couple years ago, Eden. And so there's a demand for this, and there's several firms that have gotten into it. So we've gotten bids from the firms that have worked with Sutter, that have worked with UCSF, that have worked with San Francisco General, and we're going through the RFP process right now, and we'll actually be interviewing firms next week, picking them, and they work on a whole move plan with the idea that at this point in time, the plan would be on one day, we open and we move patients over from the critical care and med surg area, and then just open the ED, at a certain point, and patients will go to that new ED at that time. So that'll be, at this point in time, looks like a day that will occur on. And I would guess it's going to be the fall of next year.
It's very, very complex, because you got double staffing, you've got,
Yes.
just, it's an interesting puzzle to manage.
Yes, and then you've got to turn on, the phones, the computers, everything have to, work at that point in time.
Is it, so there's an incentive, I would assume, to move as quick as possible, to have it operational as quick as possible?
Right.
Because not only is there a cost involved in the transition, the longer it takes, the costly it is. But more importantly, you have a certain capacity that you don't have in the existing structure.
Correct.
In the new one, that allows you to process more people.
That's correct.
And that's a revenue stream.
That's correct.
And so there is an incentive to finish this as quickly as possible.
Yes. And there's an incentive to open it before the winter, which is when we get the busiest. And so if we can get that all done and it's functioning, that makes the ER ready for the heavier crowds. That means critical care heavier when the greatest demand is on it. So yeah,
So realistically, we're looking at September, October?
I think it's going to be September, October, yeah. We haven't selected a date yet, but that's what I think it's going to be.
Okay. If there's nothing else, meeting is really adjourned.
Okay. Thank you.
Thank you.